Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundoora, and I endorse this clipboard product.
This presentation is on the ligaments and membranes of the knee. So the knee joint capsule, like all joints, has a fibrous capsule. It has several attachments. We can see anteriorly we blend with the quadriceps tendon, the patella and the patellar tendon. Fibrous capsule attaches to the femur posteriorly, just proximal to the articular margins of the condyles. So it's enclosing that whole intercondylar fossa. We have a tibial attachment, and that's just distal to the articular margins of the tibial condyles, although we note that it does leave a gap for the popliteus muscle tendon to exit. Now the knee joint capsule, the synovial membrane, is shown here in red. So blue, we had that fibrous capsule. In red, we see the synovial membrane. And synovial membrane, this is the most complex synovial membrane in the body. This lines the fibrous capsule, but it doesn't enclose the anterior cruciate ligament or the posterior cruciate ligament. So we can say that there's an invagination and it leaves them excluded. So we can say they're extrasynovial, but they are intracapsular. They're inside the capsule. The synovial membrane forms many bursa around the knee. Bursa are found wherever there's friction, and bursa means a pouch or a purse, and it's just a pouch filled with fluid, and this stops friction. Some of these are continuous with or communicate directly with the synovial capsule, so the suprapatellar bursa, for instance, while others don't have any contact with this at all and are completely independent, such as the prepatellar bursa. Shown here is a picture of bursitis. So if someone had a job where they spent a lot of time kneeling, plumbers for instance, they might get an inflammation in the bursa, and that would be a swollen, painful condition. We have knee joint ligaments. Looking at our cruciate ligaments, cruciate meaning cross. These two ligaments cross over. So we have an anterior cruciate ligament and a posterior cruciate ligament. The anterior cruciate ligament starts on the anterior intercondylar area of the tibia, and it connects proximally to the lateral condyle of the femur. The posterior cruciate ligament attaches to the posterior intercondylar area of the tibia and connects proximally to the lateral aspect of the medial condyle of the femur. So let's look at their function. Here we have the patella, so this must be anterior, so attaching to our anterior tibia. In the intercondylar region we have an anterior cruciate ligament. So ligaments work when they're tight. So as they get pulled tighter and tighter, they prevent movements. So we can see that this is going to be pulled taut when the femur is moved posteriorly or the tibia is moved anteriorly. These both result in the same effect. So to help us to remember this, we might say that the anterior cruciate ligament attaches to the anterior tibia to prevent the tibia moving anteriorly. Likewise here we have a posterior cruciate ligament. The posterior cruciate ligament attaches to the posterior tibia to prevent the tibia moving posteriorly. It also prevents the femur moving anteriorly, but relative to each other, that is the same movement. Like any hinge joint, the knee joint will have a medial and lateral collateral ligaments. These are ligaments that lie on either side of a hinge joint. On the medial side towards the body, and we can see this is medial because this is our fibula, and when we think fibula, we think perineal or lateral. So a medial collateral ligament begins on the medial epicondyle, and it attaches to the medial aspect of the proximal tibia. We can see that it actually blends in or becomes one with that medial meniscus. A lateral collateral ligament begins on the lateral epicondyle, and attaches to the head of the fibula. This doesn't blend in with those fibers of the lateral meniscus. So the function of these is stability. So our medial collateral ligament will prevent forces which will cause either of these bones to move laterally. Our lateral collateral ligament will tighten up when we try and move the femur medially or the fibula medially. So they resist opposing movements. We also have other ligaments and structures which contribute to the stability of the knee. The oblique popliteal ligament reinforces the capsule posteriorly. It's called the oblique popliteal ligament because it's oblique. It neither runs up and down or superior inferior nor side to side. It's oblique and it's in that popliteal fossa region. The iliotibial band reinforces the capsule laterally, so it's crossing that knee laterally and it's acting like another ligament over that joint. The quadriceps tendon is all those quadriceps muscles blending together, attaching to the patella and forming a patellar ligament or patellar tendon, and this acts to reinforce the joint anteriorly.